Assalamu alaikum doctors, welcome to my YouTube channel MBBS and BDS lectures. Today is the second video of rapid revision course of Community Dentistry, which is very important for NLE, MDS, NBD as well as for BDS students. In this video we will discuss about fluoride toxicity and its management, and regarding fluoride's toxicity there are some terms which MCQs was come in March NLE exam, like potentially lethal dose, certainly lethal dose, and safely tolerated dose. These are very important. Now, first, fluoride toxicity is of two types. If there is excessive injection for short period of time, and next is excessive injection of fluoride for long period during tooth development. Now, first, in fluoride toxicity, excessive ingestion for short period, in result there will be acute toxic effect like gastric disturbance, nausea, vomiting, and death. Second is the excessive ingestion for long period during tooth development. In the result there will be dental fluorosis. But the effect of a long-term fluoride exposure on bone is still controversial. Now come to the fluoride metabolism. Fluoride is absorbed rapidly from stomach. Peak blood level occur 1 hour late. It is excreted via the kidney, but traces are found in a breast milk and saliva. The placenta only allow a small amount of fluoride to pass, therefore prenatal fluoride is relatively ineffective. Now in fluoride metabolism, the MCQ's point is that its peak level occur in 1 hour, and it is excreted via kidney, and it is absorbed from stomach, and trace elements are found in breast milk and saliva, and fluoride can pass placenta. Now come to the symptoms of fluoride toxicity. Symptoms develop very fast a few minutes after ingestion. In fluoride toxicity, in low dose the symptoms will be different. At high dose the symptoms will be different. At low dose there will be nausea, vomiting, abdominal pain, diarrhea, hypersalivation, tears, discharge from nose and mouth, and headache. In high dose there will be convulsion, spasm of the extremities, generalized weakness, blood pressure drop, cardiac arrhythmias, respiratory acidosis, extreme disorientation, coma, and death. Now come to the important terms related to fluoride toxicity. Number one is these are very important. Number one is the STD, safely tolerated dose. What is safely tolerated dose? Dose below which symptoms of toxicity are unlikely. Mean at that below that dose, or at that dose there will be no toxicity symptoms, which is known as STD, safety tolerated dose, and you should remember its value, which is 1 mg per kg body weight. 1 mg per kg body weight is the safety tolerated dose. At that dose there will be no fluoride toxicity symptoms. Next is the PLD, which is the potentially lethal dose. How we define PLD? Lowest dose associated with a fatality. Patient should be hospitalized, and the value of the PLD is the 5 mg per kg body weight. Now how we remember the STD? S means single mean 1 mg. S means single mean 1 mg. And PLD mean P mean potential, LP mean 5, P and 5 same words, mean 5 mg per kg body weight. Next is the certainly lethal dose, CLD. At that dose there will be no survival, which is the from 32 to 64 mg per kg of body weight, certainly. Now now how we remember the dosage? In STD, S means single, means safety tolerated dose 1 mg per kg body weight. Second is the potentially P mean 5 mg per kg of body weight. Next is a certainly lethal dose CLD. You can remember by half and complete. Half is 32 and when we double the 32 there will be 64 mg per kg body weight. Now come to the treatment of fluoride toxicity. Fluoride toxicity need immediate treatment, and for fluoride toxicity we give antidote, which is the milk and calcium gluconate, and calcium chloride or calcium gluconate and milk. Now in treatment of fluoride toxicity need immediate treatment. Here we should reduce the absorption of fluoride. How we can reduce? Number one, induce vomiting immediately per patient. Induce vomiting immediately. We can give emetic drugs to induce vomiting, but providing no risk of aspiration into the lungs. Second is the reduce bioavailability in the blood. How? By 1% calcium chloride or calcium gluconate, and next is the milk. These are the milk, calcium gluconate or 1% calcium chloride is the antidote which reduce bioavailability. But we can reduce absorption by two methods. Induce vomiting, we give emetic drugs. Second is the reduce bioavailability by 1% calcium chloride or calcium gluconate and milk. Next, transfer patient to hospital as soon as possible. Additional washing of a stomach with a lime water. Next, IV fluid replacement, calcium gluconate and sodium bicarbonate. Calcium gluconate for blood calcium level and sodium bicarbonate for urine flow rate and urinary pH. This is all about fluoride toxicity. Now, if you like my video, press the like button and share this video with your friends. If you're new to my channel, subscribe my channel by pressing the red subscribe button, and also press the bell icon in order to receive my each new video notification. For watching my videos, I am very thankful to you. Thank you very much.